Assalamu alaikum. This is Faizan Mirza, and we are discussing the topic the arts, a worthy intervention in biopsychosocial model. So, what are we going to discuss today is how arts is influencing our daily life, and not from just our current times or the present times, but from it has come quite along the history. So, if you just look at this photograph, this is a photograph that I found randomly on net. It very clearly shows you that this person is having some entangled thoughts, and he or she needs some external help to just untangle his thoughts and make his which can make his or her life more easy, or something which he can cope up with. So this pretty much tells you how I think we all can relate to this photograph, and we know that somewhere in our life we have been through phases where we have suffered through to with such extent of troubled thoughts. How are we discussing arts here? Arts basically is just an expression of physical expression of creativity, which is influenced and dictated by society and culture. It can be classified into four different categories. I'm discussing three here, and then we'll come to the fourth: literature, performing arts, visual arts. Literature, drama, prose, poetry, creative writing. In performing arts, we have dance, music, theater. Visual arts, maybe have painting, sculpting, architecture, photography. Then there is combination of these cinematography and comics. There can be so many more that we can put here. So arts basically is a big umbrella, and these things just come under it. When we're discussing arts, we cannot ignore aesthetics, because aesthetics is related with art, and with art we are trying to see how it is influencing the brain. So aesthetics is a branch of philosophy where we discuss the exploring of nature of art, beauty, and taste, and it deals at two levels: at the level of creation and at the level of appreciation. The creation is from the artist, the creative thinking of an artist behind creating a work of art, whereas appreciation comes from people who are perceiving that creation, and how are they putting that creation to use. Either they are enjoying it, they are criticizing it, or they are simply using it. So you can see that if a person is enjoying it, criticizing it, or using it, brain, mind, and behavior of that individual is being affected. And yes, it can be used as an intervention for people who are coping with certain mental health issues. Obviously, I'm not speaking about some chronic issues here, but yes, to an extent, mild issues. When we're discussing creative thinking of an artist, most of us are not artists. Artists are few. So yes, it's just few people out here, and you can see that their creation can affect many people out there, and this action actually becomes amplified. So this can be used an intervention for artists as well as in the fans of artists. So the aesthetics leads us to the passive and active association with art. This photograph here is again taken from a wallpaper that I downloaded from my smartphones a long time back. I think 4 years back. So yes, it is. I feel I can relate so much to it. You can see water, you can see rain, you can see sky, you can feel the air, you can feel earth, you can feel warmth, you can feel music. So much so passion in the same photograph. So this is just an impact of a single photograph, that how much you can relate to in a single photograph. Again, it's just what I am seeing. It might vary from, as I said, that it's how I am enjoying it, how I'm using it, or how am I criticizing it. We all may differ on that. So according to researchers, people who have an access to a hospital window which is overseeing a natural view, their span of stay in the hospital decreases, and their recovery is a bit quicker. This led us to the realization that art therapy is actually important. We know psychotherapy, counseling are used for people suffering with mental health issues to help them cope up. Art therapy is also of a similar sort. Art therapy It will also help the people suffering with these issues. It promotes well-being. Insight is enhanced. It relieves a person's from emotional baggage, trauma. It helps the person resolving conflicts and problems. It makes a person have a higher self-esteem and enriched daily life. Art education enhances cognitive skills in children. That's been seen and studied and reported in various studies. Plus, music instruction, it develops specific spatio-temporal skills in people who are involved in that. This is a comic image though. Art therapy is used in the field of medicine. It is being used in the field of medicine, and its use is actually being there. It's there. So this image here, this shows you how, this is obviously a comical image showing you how the person have evolution have occurred and how a person has evolved with music. But anyhow, that's on a lighter note. fMRI, PET scans, EEG, these are modern techniques. They have been used to study the effects of music on the brain. And it has been seen that various regions of the brain, they get influenced or they get activated when a person is engaged in music, either listening to it or playing music. The field of medicine or research that is working on art therapy is behavioral, endocrinological, and biochemical field. And the studies related to behavioral, endocrinological, and behavioral biochemical studies are in their infancy right now. If we discuss music, so music listening, obviously we all know that cortisol is a stress hormone. So listening to music, it lowers cholesterol. It lowers cortisol. Sorry, not cholesterol. It lowers cortisol. For cholesterol, you'll have to work your way out to reduce the level of cholesterol. So yes, cortisol gets reduced when you listen to music, and it reduces stress. And studies have reported that a raised level of cortisol for a long period of time, or prolonged cortisol raise, is actually predisposing a person for Alzheimer's disease. And artistic activities, they even reduce the risk of onset of dementia. And dementia, people suffer with gradual memory loss, and it can be very severe, making the person's life very difficult. Music activity particularly has been found to be most effective among these art therapies, amongst the most. It's in fact not the only one. We'll discuss a few more. So it's in one of the studies I found that in people suffering from mild to moderate depression, music therapy was found to be more effective than psychotherapy. They reported that they took two groups, and they took one group for psychotherapy and the other group for music therapy, and they found that piano playing or music therapy helped them cope up with mild to moderate depression in a much more helpful way than merely psychotherapy. So yes, much research obviously is needed for this. This book here, if you can see, it shows some incomplete sketches. If you can see, you might be able to see that yes, there are some awkward sketches of face, some incomplete expressions, nose and eyes. The shape of eyes are different, and you can see, you can just Google this image and come up with this. This book is The Artistry of the Mentally Ill. What's this book? This book was compiled by a person. He was a German psychiatrist. The Artistry of the Mentally Ill. He actually, what he did, all the people who were inmates of asylums in Europe, he collected their artistic expressions and productions and expressions that they had been doing all along while their stay in their asylum in Europe, all across Europe, and he published it as a book in 1922. So you can imagine that 1922 we are living in 2012. So this was the first thing that highlighted that yes, there is some strong link between mental health and art, and it cannot be denied that yes, somehow they both are correlated, or somehow one can be helpful for the other. When we discuss evidence on the basis of neurology, we say that yes, both hemispheres, we know the cerebral hemisphere works in two parts, are involved in art expression. This was again seen in the researches, and again it was expressed in some other research as well. PET scans have shown an extensive communication of brain within the structures of the brain, and that was even when a person was just making a simple drawing, that might be a simple sketch or might be a simple stick drawing of an apple or anything, for instance. And the brain regions that showed extensive communication in that time were the cortical regions of the brain, limbic system, midbrain, brain stem, and they all were activated during expression and perception of that art. Not just expression, perception as well. Like I was discussing a few minutes back, that active participation as well as passive participation in art, both are equally important and both have fruitful outcomes. Virtual reality. I think we are all familiar with this term, living in the age of these smart gadgets that we have all along. So you can see this patient lying, and you can see that he is badly burned. He is suffering from extremely painful case of some disease, probably burns. So people suffering from post-traumatic stress disorder are being subjected to use of virtual reality cameras or devices, which helps them bear the pain, recover from that trauma in less time. And even if some painful procedure is being done, these VR devices have been found to be very effective. Patients where some needle piercing is to be done, some puncture is to be done, some oncology based treatment to be done, some nail extraction. You can see this nail is being extracted from this person's finger, and his hands were all burnt, and he had to like suffer a great deal of pain. So he was given this VR device to just focus, and while the staff was done with that procedure. So it modulated the sense of pain. It modulates the sense of pain, in fact. Dementia, a case was studied by this Drago and his team in 2006, and he came across an artist who was suffering from dementia, and he analyzed her photography, her drawing skills, not photography, her work from like before the onset of dementia and after dementia, and he saw that all her paintings which were before dementia were all quite complete. They were complete artwork, and the ones which she had made later on after dementia were incomplete artwork. They didn't have the air of completeness, or they were unfinished products. But that was not all. Her initial work was less emotionally driven and less powerful, but now her work was more intense, it was more powerful, which shows you that yes, her mind or her brain was trying to let go of emotions which it could not translate verbally. So the way art is considered to be a way to let things out, let things go off. So this becomes helpful here. Theaters and plays have also been important in this regard. This is a funny comic that I saw, and this was so dramatic that I found it to be very, very unique. And you can see that how this person's thoughts are all jumbled up. His face, he could not even realize his face, and he just drew everything that was there on his face, on his mind, on his brain. And once it was on the paper, his face was back. So yes, art therapists, this is what art therapists do in theaters and plays. They promote that in theaters and plays, the costumes and the props and the puppets and the masks and the set designing, all these things are being done by people themselves rather than buying something from the market or buying something already available. This involves created materials which actually is an expression of the inner feelings of the person. When you put those feelings forward, yes, the idea is that your product will be much more useful. Photography, no one can deny photography art. We all know what a simple camera of a mobile phone or a DSL camera photograph can do to us. So yes, how is it important? Why is it in 2004 said that photography involves inward, outward connectiveness together at one place? The person is connected from inside as well as from the outside to the world views, and he or she expresses himself in a photograph. Later on, he categorized the photography as art therapy into three categories, where he said there we have phototherapy, where personal shots of family album or some old pics are used to show so to individuals just to warm up their emotions. And therapeutic photography, where the snapshots are taken to express the feeling, to let go of that weight burden from the inside. And photo art therapy, where the photos are taken by professional photo artists, art therapists, that can relieve the people passively from their stresses of day-to-day life. This is one photograph. This was very popular a few years back, and those who have been following memes and internet and social media must have come across this. So you can see the power of this photograph, the release, the thought process, the creativity behind this photograph. You can see there are 6 different kids, and each one is suffering to a different difficulty. One child being shown as being molested by people who wear the religious costumes, or they hide behind religious garb. Then we have this issue in various places where we have foreigners coming to new places, and they kidnap children, they molest children. Then wars, they play havoc with the life of children. Then smuggling of organs, and children smuggling, then children kidnapping, and yes, who can ignore childhood obesity? So all in one, I always find this photograph to be very effective. Digital art therapy, this is probably towards the end that I'm discussing. It's a recent addition that we are using iPads and touch screens, and there are so many apps like Doodlebuddy and SketchUp 3 modeling and so many others. These help people with suffering from autism to express themselves. People with autism cannot they don't really have a good tactile connection with anyone. So they cannot express themselves well when they are holding brushes and pencils and sheets. But when the tactile contact is not there, and they still can express themselves conceptually and perceptually on a tablet or on some gadget, they find digital art therapy to be very useful. Sculpting using clay, models using they have a stronger impact, 3 dimensions. You can see this sculpture here. It is again, I find this so appealing. This person who's dying, and his close associates are surrounding him, holding him from falling, trying to make sure that he stays there, holding him, balancing him, trying to bring him back to his feet. Someone holding him from his back, somebody holding from his shoulders, right under the arm, somebody holding him under the feet. A very strong sculpture, I found it. So this is what art can do to us. But yes, this is us as well. So a very good sculpture being mimicked by a group of youngsters. Oscar Wilde said, all art is quite useless. And I guess he used it cynically for such people. So aesthetics, as I mentioned, is very important when we're discussing art. The take-home message at the end, what are the benefits of art therapy? Yes, the same thing we'll be discussing. It enhances vocabulary or verbalization in children. It reduces depression and Parkinson's. It enhances cognitive skills in people who are elderly and suffering from age-related dementia. It enhances the psychosocial treatment of cancer patients. It is found to be very effective in pediatric asthma patients as well. And lastly, it helps coping up with PTSD as I discussed in VR. So, from my side, that was all. Thank you for paying attention.